My name is William Paiva. I'm the Executive Director at Oklahoma State University for the Center for Health Systems Innovation. The Center for Health Systems Innovation was created about 3 years ago. I took over the center about 2 years ago as the Executive Director. We established our mission to be kind of a two-part mission. The first was to look for ways that we can improve the way we're delivering care in rural Oklahoma. And then the second is to mine a large data set that was donated to us by Cerner Corporation called the Cerner Health Facts Database. So we really do two things. We look for care delivery innovation in the rural marketplace, and then we develop and find interesting healthcare data insights leveraging our large data set. We have over 50 million patient records over the last 14 to 15 years that have been collected through Cerner EMR systems. So we have the clinical data, the laboratory data, the pharmacy data, the laboratory data, admission data, billing data. It's the largest relational healthcare database available. And Oklahoma State University is one of the only universities, if not the only university, that has exclusive access to that database. Ultimately, our goal is whatever interesting insights we find, either from the data side or the care delivery side, is to come up with an innovation, to come up with a new way of delivering healthcare, or find a new way to deliver healthcare and actually develop or actually deploy it in the rural marketplace. So we don't want to just do the research and come up with the conclusions. Matter of fact, that's probably the least interesting part of the job. It's really about how do we take those interesting insights, develop an innovation or find an innovation that meets a need, and deploy that into the rural healthcare marketplace and show that we can improve healthcare. So we really are all about implementation and innovation. The research is the fundamentals that actually inform the areas we focus on, but ultimately it's all about the implementation of those innovations. We've grown very rapidly over the last 2 years. We're up to 15 full-time employees in the center, and we have about 30 students that are working on any number of projects. Because of that rapid growth and because space is often limited, we have people kind of scattered all over the place right now. There's a new facility that's being built in Tulsa at the medical school campus where we'll actually be able to consolidate a lot of our efforts into one location. So right now we're kind of scattered because we grew so fast and their space is obviously not abundant, but we will consolidate it when the new facility is built. So we're going to actually try to do 3 events a year, okay? The first event that we did is a Rural Health Innovation Weekend, which is very similar to the startup weekends that some of us may have participated in throughout our lives in innovation and entrepreneurship, et cetera. And really what we did there is we brought together rural practitioners, innovators, entrepreneurs, developers, to spend a weekend to focus on what are the major and most vexing problems facing our rural practitioners, and how do we develop solutions to address those. We had that weekend and we had over 91 people that came to the event. So we had over 9 different projects, and many of them are actually now have transitioned into our implementation engine at the center, where we're actually working to develop the IRB protocols to actually go test those in the field. So that's the first event. The second event we did, so we had the Maker Health event where we actually brought folks from MIT who perfected the Maker Nurse, Maker Health event, and actually brought them here to teach many of our residents, medical students about using the Maker Health principles so they can solve problems on the fly while they're providing the care. So that's the second event we just held. And in the fall, we're going to hold a rural health data hackathon, where we're going to take this large piece of data and we're going to put it out on the web. And for 2 months, people are going to have the ability to go find whatever insight they can get out of the data. And then ultimately, the most interesting insights will actually have awards for those particular insights. So we'll do 3 events a year. I want to really highlight the value of this data set that's been given to us. It's a phenomenal asset at Oklahoma State University, and it really is a treasure trove of data. There's lots of people who have data out there. A lot of times the payers have data, Blue Cross Blue Shield, Oklahoma Healthcare Authority. A lot of that is claims data. What we have on our side is all the clinical data. So the laboratory results, the clinical protocols, the clinical procedures that were done, the outcomes, et cetera. So we have a lot of clinical data. So a lot of the work that's really exciting that we're doing in the center, in addition to the care delivery and rural health, is using that data set to actually inform and support those exciting activities we're doing on the rural data set that heretofore wouldn't be able to be done without the data set. I'll give you an example. We decided to go into lab data. We have 1.4 million diabetics in the data set. which have over 5.3 million clinical encounters. So what we decided to do is to see if in the lab data we could actually predict whether or not a patient was progressing with diabetic retinopathy. Because we have the clinical information about their diabetic retinopathy, we have all the lab data, so could we develop an algorithm that could, just out of the existing lab data, predict whether or not the patient was progressing as a diabetic retinopathy patient? Then you eliminate the need for the ophthalmic visit, right? Diabetic patient comes in, they get their normal blood work, the algorithm runs on top of it and predicts whether the patient has diabetic retinopathy. So think about a rural marketplace where there are no ophthalmologists. The algorithm can now run in a primary care setting. It's a tool for a primary care doctor to actually manage diabetic patients' diabetic retinopathy. That's the power of that data, which gets me really excited, because those tools that we develop on the data side, we can layer into the rural healthcare to improve rural healthcare, where you lack some of those specialists that you have the benefit in the urban markets of having available to you. So that data set is a real exciting data set for us, and I really want Oklahoma and Oklahoma State University to become like the nexus for healthcare data analytics. Actually, one of my presentations, I describe it as, I want Oklahoma State to become the Silicon Valley of healthcare data analytics. And they have an opportunity to do that with that large data set, because it really is a differentiating asset for us. So at the end of this, how will I measure success? At the end of 5 years, did we improve healthcare, reduce costs for many of the target markets and many of the targeted rural populations?